Very good evening, viewers. Welcome to you all. As summers are approaching, and we all should maintain hydration level, which is very crucial for all of us. We all know that how rotten dehydration feels. Not only do we will feel sluggish and cranky when we don't get enough water. For people with type 2 diabetes, dehydration can be especially very dangerous. That's because it causes blood pressure to fall and the body to secrete stress hormone like norepinephrine, epinephrine, which may raise blood sugar. And to discuss today's module, that is water and health, we have our very host, our very own Dr. Sanjay Kalra sir, and our guest speaker, Dr. Navneet Agarwal sir. So before I hand over the platform to Dr. Kalra sir and Dr. Navneet Agarwal, let me have the opportunity of announcing the names of those doctors who have answered the quiz questions correctly in last module. The names are Manvit, please share the slides. Dr. K.M. Prasanna Kumar from Karnataka, Dr. Major Prachi Garg from Uttar Pradesh, Dr. Anupama Swami from Karnataka, Dr. Lakshmipati Bhupati from Tamil Nadu, Dr. Ashwini Kumar from Uttar Pradesh, Dr. Sanjay Suryavanshi from Maharashtra, Dr. Sanjeev Puri Namrata Puri from Punjab, and Dr. Gajanan Sanak from Maharashtra. So congratulations to the doctors. And dear viewers, on 15th of April, we are having a very biggest event in the country. We have Dr. Vivian Fonseca, who will be addressing on the topic of a scientific approach to improving vascular and metabolic health in diabetes. Dr. Vivian Fonseca is the Assistant Dean for Clinical Research and Chief of Endocrinology, Professor of Medicine at Toulouse Tulane Alumni Chair Diabetes. And our host is our very own Dr. Sanjay Kalra sir, is President-elect South Asian Federation of Endocrine Societies. Dear viewers, please register yourself on the web link enerzal0.com for this mega event on 15th April at 9 p.m. With this, I hand over the platform to Kalra sir to introduce our guest speaker and continue with today's module. Over to you, sir.
Thank you, Rahul, and a warm welcome to everyone who's gathered with us today. Best wishes and celebrations for the month of Ramadan that is due to start tomorrow, and also for the Navratra festival, which is due to start tomorrow. We've been discussing a very simple thing, H2O, dihydrogen monoxide, such a simple thing we've been discussing, and we've been doing that for the past 3 episodes at least. In the first episode, Dr. Sunil Kota spoke about the physiology of water. Then Dr. Saptarshi Bhattacharya continued the discussion talking about the endocrinology of water. And then Dr. Ashok Kumar Rohila shared insights about the nutrition of water. Let's make all that comprehensive. Let's put it all together and let's welcome Dr. Navneet Agarwal from Gwalior, Madhya Pradesh. Warm welcome, Dr. Navneet.
Thank you, sir.
Dr. Navneet is a physician and diabetologist working at Gwalior. He wears many hats, many turbans. Apart from his clinical practice, he is involved in delivering health care, diabetes care especially, to the poorest of the poor. So when we read the theory of Sarvodaya and Antyodaya, these are part of our political philosophy, we read about the theory, but Dr. Navneet actually puts it into practice. Not only is he reaching out to the poorest of poor, that is Antyodaya, he also works for Sarvodaya, which means for the benefit of all. And he has been able to successfully utilize modern technologies, modern means of communication, like the Beto platform. Perhaps later on we'll ask him to speak about that. We'll ask him to speak about that as well. And he's been able to utilize that to enhance the quality of diabetes care that each and every Indian citizen can get. And he uses the word democratization of diabetes care quite often. He is also an advocate for public health. Dr. Navneet, warm welcome, but we have a question for you before you
Thank
begin.
you, sir.
Our
Sure, sir.
topic for today is water and health.
And health.
The question coming from the audience is, how precious is water?
So precious, if we talk of how precious is water, I think everywhere we see a single line which is written everywhere in the, say, like, the across the country, Jal hi Jeevan hai. So I think you cannot imagine life without water. So we can understand the how precious it is that no single living organism on this earth can survive without water. So we can say without it, nothing is there. And the whenever we think of life on any other planet, there is always a search of water, whether there is a water or not, be it moon, be it any planet.
Right. So water is precious. We can't live without that. That is quite clear. Dr. Navneet, would you like to share your insights? Uh, how important is water to health? What is the interrelationship between water and health? And we look forward to listening from you, learning from you.
Sure, sir. Uh, Pratik, can I share my slides? Hello, are my slides visible?
Perfect.
Perfect, sir. Thank you,
Yeah.
sir. So, thank you, Sanjay sir, for the nice introduction. Thank you, FDC team, for inviting me for such a precious talk on the role of water and health in general health. Like we have been listening to so many speakers, my previous speakers has spoken about the importance of water in different facets of life. So, I'll be just talking on the basics of water and the human body. So, as Sanjay sir was asking, how it is precious, we can say two-thirds of our all body cells contain water. Every single cell, just imagine, of the body is water, and it plays a main important role in all body functions, any body function, all biochemical reactions of our cells or intercellular reactions. It is used as a building material. Like when we think of building any construction, even in any construction, when we have the bricks, we have the cement, but without water, no brick or cement can make a building. Similarly, without water, we cannot survive. Our cells cannot survive. So, like it is a building material for every cell. It is involved in mechanism for controlling and maintaining normal body temperature, as we see, and particularly in this summertime, this will be more important. And it is a medium for carrying nutrients to the cells and waste out of the cells. So, like every reaction, every biochemical reaction, metabolic reaction of cell of the body is dependent on water. And if you talk of the percentage of water in the life, it is from the, like say, like lowest is in the seeds where it is 20%, and highest in the jellyfish where it is 99%. So like it helps all organisms across the globe on this earth, either in their metabolism and even for the plants. Like we know that the photosynthesis is dependent on the water only. So like all the organisms, all the living organisms, including plants, are dependent on the water. And our composition, if you see, like from the fetus, like when we are born, we are almost around 85% of the water, whereas in the babies it is around 75%, and it slowly decreases. Like by the normal adult has 60%, and the elderly population has 50% of the water. So the babies and kids have more water, and as we age, we have a drop in the water content in the body. And obese people have more fat than the skinny people. So like muscles are 75% water, whereas fat is only 20%. So that's why the older people, like who has a loss in their muscle mass, have a lesser percentage of the water in their body, and women's have a less water because like they have a more fat content, so they have a less water content. This is just the water content of the body, just to have an insight that how much importance of water has in our body. If we talk of the individual organs, be it brain, to the blood, or to the muscles, or to the any other vital organs. So like if coming to the what is the water balance in our body. So like as we always discuss about input versus output. So the input, like there's somewhere around 1500. It is just an approximate average, like maybe it may be slightly less in the winters, maybe slightly more in the summers. So like roughly around 1500 comes from the direct drinking of the water, and then 700 ml comes from the food material which we are taking or consuming in the form of maybe semi-solids, or the like even the like sabjis or curries and everything. And then the metabolic water comes around 300 ml. And there is a output of the water, like somewhere around 1500 comes from the urine, and then we need water or the hydration for the sweat, and then respiration, and in the feces. So like somewhere this intake versus output, and if it is balanced, but the output has to be there. So like if there is a reduction in the input, we'll have a negative balance, and that can cause the diseases and the dehydration. So what are the recommendations? Almost in the children, so around 1.3 to 1.7 liters a day. In males, so roughly around 3.7 liters a day. In women, it is around 2.7. In pregnancy, you need more water. In the lactating women, as because of the obvious cause, they are lactating, they have to secrete milk, so like they need more water than the non-pregnant or the non-lactating females. What are the various functions of the water in the human body? It transports, as we discussed, in the nutrients and oxygen. So, like whatever the nutrient, be it the glucose, be it the amino acid, be it the whatever the nutrient which is required by the cell for the internal metabolism is traveled by the water or like by the blood, and it carries oxygen into the cells. It regulates the body temperature. It is a great detoxifier. It moisturizes the air in the lungs. So, like whenever we have inhale the hot air or like the dry air, then we have more say loss of the water from the lungs. It helps with the metabolism. It protects the vital organs. It helps organs to absorb nutrients and protects and moisturizes our joints. As far as the fitness, like nowadays the fitness, like everyone is crazy about the fitness and the weight loss. So water is important for the fitness and weight loss also. Like it fills up, like if you have enough of water, it fills the stomach. It will provide you satiety without adding any calories. So like it is a zero calorie. I think whenever we talk of management of type 2 diabetic patient or any diabetic patient, we always talk of the free foods or the zero calorie foods. Like water is the most important zero calorie food, and dehydration degrades a person's ability to exercise and burn calories. So like we should be properly hydrated if you're going for an exercise or a gym or any physical activity. And dehydration, like suppose if the patient is not taking the enough amount of water, it will reduce the protein synthesis which is required for the building or the repairing the muscles. And if we talk of water as a chemical substance, it is a solvent. It is a good solvent, and because like it has a one oxygen and two hydrogen atoms which are covalently bonded. So the water molecule is polar because electrons are not equally shared. So it is a universal solvent. It is wonderful solvent for anything. So it acts as a way of transport. It is a carrier distributing, be it like if you see in the plants through the sap, it carries all the minerals and vitamins from the soil to the supply to the all the say leaves, flowers, and the stem of the plant. Same way in our body as in humans, like it supplies all the different substances like in the blood, like it transports everything. And it is being a good solvent, it allows them to dissolve the substance they are transporting. So like they'll be easier to transport them. It is also acts as a reactant. It is a good solvent, allows many reactions to occur, like in the photosynthesis in the plants. These reactions release oxygen, which is vital to humans. So like it is from the plant, like if the plants are taking water, in turn they are giving us a good oxygen. So, and as a lubricant, like it is an effective lubricant around the joint. So like when we talk of the sandwich fluid, it is again a fluid which is made mainly of water, and mainly internal organs have fluid around them to keep them protected. Like in the brain, if we talk, it is CSF. In the lungs, we talk, it is pleural fluid, and in the eyes there is all mix of fluids we have, and even our tears. So like almost around every organ, important organ, to function, whatever the function it has been provided by the god, needs water. And when we talk of hydrolysis or the energy release, again in the all the cellular reactions, we know when the ATPs are generated, we need water or the H2O for carrying out any reaction to generate the ATPs, which are the smallest or the main unit of the energy which is provided by the like generated in the cells. And as far as the regulation of the body temperature, it has, like we know, the water has a large heat capacity which helps limit change in the body temperature. So like whenever like we see in the normal term, whenever a patient has a higher temperature, we always call advice for the cold sponging. And this water allows the body to release heat when ambient temperature is higher. So like whenever there is a higher temperature, patient like a person begins to sweat, and this evaporation of the water from the skin provides like it is an efficient cooling of the body. So this is just a regulation of the body temperature. When there is a normal blood flow, 4% of the blood flows through the flows to the skin for the heat loss. But when there is a higher temperature or in the heat stress, almost around 48% of the blood flows to the skin for the heat loss. So like just imagine the change from the 4% to the 48% depending on the temperature where we are having, we are surround us. So this circulation will help us in dissipating the heat. And this is also used in the metabolism. We all know this from our MBBS days in the biochemistry. We have gone through this Krebs cycle and all this, like the generation of the ATPs. So this is also required. The water is required for generating and for any biochemical breakdown, whatever we eat in our cells. And it helps. We all know that it helps for the waste removal. So like waste products, including toxins, so like it is important detoxifier, and it helps in excreting out the waste through the urine or the feces. So we have seen that the water is an important aspect of life, and we cannot imagine a life without water. So like when it comes to the health, every person on the earth has a right to have a good quality water, the safe drinking water. So irrespective of our stage of development, social, economic conditions, we have all right to access to the safe drinking water in the quantities as well as in the qualities to our basic needs. And WHO has recognized that access to the adequate water supplies should be there in a fund. It is a fundamental human right, but we have to consider that there are water related diseases which are troubling us. And when we talk of these like contaminations in the water, there can be chemical contamination, there can be bacterial contamination, there can be viral contamination. So the common chemical contaminants, nitrates, arsenic, fluoride, and I'm sure you all must have read about all these contamination in the various newspapers, in the various past, and so many stories about the contamination of at the different places. So, like the prevalence of arsenic and the fluoride in drinking water is known to cause cancers of lungs, bladder, stillbirth, congenital malformations, ischemic heart disease, and the nitrates. The bacteria in drinking water in the human body can transform nitrates or nitrates to the nitrosamines, which are a compound which are formed by the reaction between nitrite and the secondary amines. And this is responsible for various diseases like in the blue baby syndrome and arsenic. They are in not in the common in India, but we have the fluoride or the fluorosis in India, which was initially very a troubling disease. But arsenic again exposure can lead to other develop arsenicosis, and which in turn elevates the risk of cancer. So arsenic ingestion can increase the risk of lung and kidney cancer. It is the most common manifestation in the arsenicosis patients. Fluorosis, ingestion of excess fluoride, most commonly in the drinking water, it affects teeth and bones. So, like moderate amount can lead to dental effects, and if this amount goes higher, we can have the skeletal deformities. And children are more susceptible to the fluoride toxicity. So, like there are some limitations, or like there are some safe limits of the chemical contamination in the drinking water. Like pH should be around 6.5 to 8.5. So this is always this is again nowadays very upcoming that which water we should use, the acidic or the alkaline. So the pH should be between, because like the water has a pH of around 7, the natural drinking water, and the upper limit of the nitrates is 100 milligram per liter, fluoride 1.5 milligram per liter, arsenic. So like we have the safe limits of the contamination of the water. Above that is not allowed, or we should not consume that water. And another area of concern in the contamination is the drugs or the pharmaceuticals, either excreted by us as a human drugs or by the animals, like the veterinary drugs or the feed additives which we are giving to the animals. Ultimately, these through the feces are coming to the groundwater or the soil, and coming to us back through the drinking water. So like we have to be thinking about that, this contamination of the pharmaceuticals or the drugs which is coming to us through the soil. So there are certain diseases. If we talk of the diseases like the which are water related diseases, so like if we see the waterborne diseases like cholera, typhoid, bacillus dysentery, infectious hepatitis, giardiasis, then we have some water wash diseases like the scabies, skin sepsis, ulcers, yaws, leprosy, lice, typhus, dysenteries, ascariasis. Then you have a water-based diseases like schistosomiasis. These are all parasitic or protozoal diseases, dracunculiasis, filariasis, threadworm. And then apart from that, we have some vector-related diseases where the bacteria grows on the water, like the yellow fever, dengue fever, malaria, so and so on. So there are some microbial quality standards for drinking water, like it should be the water containing maximum 100 bacteria, no single coliform considered safe. Microbiological standards apply to determine safety of water. Drinking water must meet defined standards, otherwise poor quality can be affecting our health. Since the improvement in drinking water quality results in substantial reduction in disease prevalence. Now coming on to like this is about, we have talked about the quality of water. Now coming on to the quantity of water. So what is water deficiency? Being 2% dehydrated can seriously degrade physical and mental functions, and being 15% dehydrated is likely to be lethal, and that can cause low blood pressure uh, low blood pressure, clotting of blood, kidney malfunctions, or the severe constipation. So these are some symptoms of the water dehydration, like when you have the like headaches, which is a very milder thing, but many of times we think that this headache may be because of something else, but it can be because of the dehydration. So we can think of the like headache as the patient is having persistent headache. We can think of the dehydration, and there is sleepiness, confusion, and this can ultimately lead, like if the patient is still not take enough water, can lead to loss of consciousness or coma. Patient can have muscular problems like the seizures, weakness, and the gastric like nausea, vomiting. So like there are multiple symptoms of the water deficit depending on the level of deficit, depending on the level of dehydration. patient can have the loss of the skin turgor and the feeling lethargic. Now, the some like the symptoms of the mild health problems with the dehydration, we can have the digestive problems like constipation, bed breath, acne, and the acne in the young generation. We always like whenever the patient comes or like young teenagers comes to us for the acne treatment, we always advise them have enough of water. Disorders like we can have dryness, dull looking, or like the loss of say uh, shining on the skin, then we can have fatigue and lower concentration levels. In this, when it comes to the severe, we can have multiple severe disorders which can affect our vital organs, and even the water deficiency in a chronic process or the chronic long term can accelerate aging, and we can have a premature aging, or like we can have like looks like we're getting older. But whenever we talk of the quantity, we should always think of the hyperhydration. So, like when there's too much water enters the body, we can have the swelling, cells try to maintain concentration gradient. So, like in that process, so we because like it'll ultimately burden the kidneys, and kidney can tolerate about 17 liters water a day. So, the excessive ingestion of the water or the other liquids, this can result in the extra work for the kidney. So, like we can have the hyponatremia. Suppose there is a dilutional hyponatremia, we can have because of the hyperhydration. So, like we should be thinking of the quality in terms of what is the recommended quality. It should be in an optimum amount of intake of water also. And because of the excessive amount of the water intake, we can have hyponatremia, and which can be the euvolemic hyponatremia, which can be hypervolemic hyponatremia. Suppose if there is a total body water increase, but the body sodium content stays the same, then we'll have euvolemic. And if it is like both sodium and water content in the body increase, but the water gain is greater, then we can have hypervolemic hyponatremia. And when the water and sodium are both lost, we can have hypovolemia, as we see in the dehydration, we see in the when patient has the water loss through the gut. This is like when patients like they are having excessive physical activity and not taking enough of water, we can have the muscle loss or the muscle injury, which can result into the rhabdomyolysis, and which can lead to the acute renal failure or the along with the hypovolemia and the acidosis. Now, coming on to the bacterial contamination, we know that there are certain bacteria which can cause disease to the human being, and they are transmitted to our body, or they are ingested by us, be it Campylobacter, which can cause diarrhea, E. coli, which can cause bloody diarrhea, mild fever, or Pseudomonas, Shigella. And like in Pseudomonas, we can have dermatitis, infection in the UTI, respiratory system. In Shigella, we can have gastroenteritis, basically dysentery. In Salmonella, we can have typhoid, which is very common across the country. Whenever you ask any patient when having a longer duration of fever, they'll go and get a Vidal test done, which is very common. Like people come with the report of that, though it is no importance, but still the people come with this and they say like, "मुझे typhoid हो गया है." And then we can have the severe form of diarrhea, that is the Vibrio cholerae, which is a very severe form of diarrhea. Then you have a virus contamination, like these are the very like virus like the hepatitis A. We know that it is a waterborne disease and it is transmitted through the ingestion of the infected water. Then we can have some rotavirus disease, which can cause severe diarrhea among infants and children. So, like these are the bacterial diseases which can be transmitted. There are some viral diseases which can be transmitted through the ingestion of the contaminated water. So, when it comes to the quantity about the say like safe or like we say non-contaminated water, we have to think about the purification. And as far as the purification of the water is concerned, we have multiple choices available to us. If we talk of the older ages, then we used to like the sand filters, or like the like, people used to say filter the water through the clothes, or there is a thin cloth, and people used to filter water through that. But then with the as the science advances, we have the very good choices of the filters like the RO, ultraviolet filtration, ultrafiltration, activated carbon, like these are candle filters, and the sediment filter which were previously used. So as far as the RO is concerned, it is the best method, but it like and the RO we focus on the TDS, that is the total dissolved solute, and it is as of now like RO is considered to the most efficacious and safe, because like it removes all the contamination or the infections from the drinking water. And so like it does not require any use of chemicals, so like it is safe, and it provides all pure water. RO, the only thing is has to settle the TDS. So basically like the recommended TDS should somewhere between around 50 to 300 for the drinking water, because like when we lower down the TDS, we are removing all the good minerals also. And it may like this can lead to like because if you are reducing the TDS of the system, it can block, it can damage, and like hard water can damage the system. So there are so many things, but the cost is again a concern on the RO water system. Second is ultraviolet, and you don't need to handle chemicals. It immediately disinfects. It has low power consumption and is eco-friendly, but it only eliminates the microorganism. It does not change the taste of water, and it needs electricity, and it does not remove all the impurities, particularly if you're talking of the ultraviolet filtration. Then there is the ultra filtration. It is in a minimal amount of water wastage during this filtration. It is eco-friendly. 99% of bacteria and viruses are removed, but it does not remove the essential minerals in the water, and it is easy to handle. But the disadvantage of ultrafiltration, it does not remove the dissolved inorganic waste. It does not remove the dissolved solids. Where in the RO, we remove all the inorganic and organic unwanted uh, solutes from that. These are the activated carbons, like these were the natural filters. They are made from material like bituminous wood and coconut shell. They're good for the drinking water, as it enhances the smell and taste of tap water. But these type of filters are not effective when they are when eliminating non-carbon chemicals like the heavy metals, nitrates, fluoride, sodium. So they have a limited service life. So like there are advantages and disadvantages of all the filter systems, be it the ultraviolet, ultrafiltration, activated carbon, and as of now, which is the more commonly used is the R water system. These are the older the filter procedures like the sediment filters, which are of three types: surface filters, the depth filters, and the adsorptive filters. But they are not very commonly used nowadays at our homes. So, with this discussion, we come to our quiz, and this is quiz one. Which of the following chronic disease is not linked to the hydration status of the patient? Am I audible?
Yes, perfect. Carry on.
So these are the four choices, and I think people will answer after that.
We can just read out the question and the choices, and
Okay,
then
diabetic ketoacidosis. You all know that this is a diabetic ketoacidosis, which we see in our commonly in type 1 diabetic patients, but even in type 2 diabetic patients. Then the UTI, urinary tract infections, heart failure, and urolithiasis, that is the calculus formation. So, which of the following chronic disease is not linked to hydration station of the patient? And then we have a quiz 2. Which of these purification techniques are not effective in removing chemical impurities from water? Ultraviolet, RO, water softeners, and distillation systems. So I'm sure you all have gone through these questions and you'll answer so that we can declare the results in the next session. So to summarize my talk, we need health. Water is life, and we need to have a good quality as well as quantity of water intake. We have to ensure in our day-to-day life, because like it helps in entire managing entire system of our body, be it metabolism, be it respiration, be it excretion. So like if you talk of the any system in our body, it needs water, be it circulatory system, whatever the system we read in our MBBS days. And as far as like the generalized fatigue, leg cramps, sprains, good mood, these are like the symptoms which we many of times might ignore, that this can be because of the chronic water deficit in our body. And it is a natural remedy for headache. We can look younger with a healthier skin, shiny skin. It can help us in losing weight, better productivity, less likely to get sick, and it can reduce the risk of kidney failure. Thank you very much for the patience hearing.
Thank you, Dr. Navneet. And your talk has created so much of curiosity, so much of interest. There is a long list of questions for you, but I'd like to thank you for speaking about water and health, and reminding us all that water is an integral part of our diet, and it is an integral part of our life, and we need to give it the same emphasis, the same attention that we give to other aspects of health. One question, Dr. Navneet, coming in from Dr. Upadhyay. Diabetes with end-stage renal disease has to have severe water restriction. So
Yes.
how do we manage? What do we tell the patient regarding water intake in end-stage renal
Yes.
disease?
Thank you, Dr. Upadhyay, for asking this question, because like we always talk of the increase the water intake, but in some certain diseases like the chronic kidney disease, as you have asked, we have to limit, because like there is we know that when the chronic kidney disease, the filtration from the kidneys reduces. So ultimately, in such type of patient, we reduce the quantity water intake, daily intake, Though in adults we advise like it should be somewhere around 3 to 3.7 liters, but in the chronic kidney disease patients, depending on the EGFR, depending on their kidney function, we reduce the dose, reduce the intake of the water, and somewhere at around 800 ml to 1 liter in a day.
And what about liver disease?
In liver disease, when the patient has a fluid overload, when patient has hypoalbuminemia, patients are say edematous, because like the lower albumin, they have the edemas, and and with the ascites, liver disease, when it progresses to the cirrhosis, again we restrict the fluid intake, even in the patients of congestive heart failure.
So liver disease, kidney disease, and heart failure, these are diseases where we should be careful.
Yes.
Neither too much water nor too little water. And Dr.
Yes.
Navneet Gupta, your namesake, he says, what about hydration in a normal person with diabetes, someone who doesn't have kidney disease, someone who doesn't have liver disease or heart disease? What should we counsel a diabetic patient?
A diabetic patient, those who doesn't have any kidney disease or liver disease or any organ involvement, should be drinking in a normal way, as recommended for a normal adult, somewhere between 3 to 3.5 liters or 3.7 liters in a day. But anyways, like if the patient is having severe hyperglycemia, they always say that they have an increased thirst, and they drink more and more water, and they go for a increase passing urine more and more. So like if your glycemic status is controlled, then you have a normal thirst, a normal water intake.
So sometimes, Dr. Navneet, we are in the middle of summer, other times in the middle of winter, and the patient comes and says, I cannot be bothered about counting. It's very difficult for me to count the number of glasses or number of mugs I'm taking. So just tell me, can I look at the color of my urine and then decide whether I'm on the right path or not?
Yes.
How do we counsel such a patient?
When it is a concentrated urine, like if you have a more concentrated urine, it is more yellowish, dark in color. That shows that you are dehydrated. So just a color of urine can give you an idea that what is the water or the hydration status of your body. And if it is a clear urine, that means you are properly hydrated.
So the color of urine will also help you decide whether your water intake is healthy or not. And if the color is clear or straw colored, in general, that means you're in a healthy zone. Dr. Ashok Masand has a query. Along with water, do we need to take other fluids like milk or juice, or is water alone enough?
No, it depends. Like basically, like if we are taking any fluid, so it should be a total amount of that. If you're taking juices, if you're taking milk, along with the water, this all should be around this much of recommended amount. It's not like you are having a 3.5 liter of water, then 2 liter of milk, and 1 liter of juices. That will go for 6 liters. So basically, your exact fluid intake we calculate in a day includes water as well as the other liquids which you are taking.
Dr. Hitesh observes that these days there is a fashion of having alkaline water. Have you observed the fashion, and is there any rationale behind it?
Yes, there is much discussion about the alkaline water. Ideally, the natural water has a pH of around say like 7. It is recommended between 6.5 to 8.5. But because like what they say that the natural water, it is the water which comes from the say like the Himalayas, or like the natural water which comes from the say mountains, and it is more alkaline because of the lime content or because of the mineral content in that. And there has been so many literature available which says that the alkaline water is more helpful in various chronic diseases, or the preventing chronic diseases, or say like providing the good health. And nowadays, the another concept is come of the ROP, that is the reactive oxidation potential of the water. And some of the companies, they are now introduced that what should be the ROP of that particular water, that what is the redox potential of that water that can provide you as an antioxidant, because water can be helping us as an antioxidant also.
And then again, Dr. Vora says water, for example, Bisleri, any mineral water, has 0 electrolytes. Is this correct? And can we use only mineral water?
Ideally not. Even we should not go to reduce the mineral content of that water, because like then that it will not be providing us the good minerals. We need the good minerals from the water. If we are removing them all, then it is just nothing. It is not good for health.
And Dr. Girish Kisota would like you to just clarify. His question is, you've already answered it, of course. Does alkaline water help in chronic disease? So he'd like an answer in yes or no.
In fact, there are studies, but I am not the person who can answer it is yes or no. We can talk of science. So there are some evidences which say that yes, it helps in various chronic diseases, the alkaline water. But there is another school of thought also which say that it is all just not that helpful. So it is still the debate is going on. People has not come out with any recommendation or the guidelines that we should always drink the alkaline water.
So
But there are some publications around the literature which says that it can even cure cancer and all that. It is good for the prevention of the cancer. It is good for the anti-aging, all these. But these are in the literature, and there are also other side of the coin also.
And there is no recommendation from any professional body anywhere in the world.
Yes. No recommendation.
Water. One more question from Dr. Vora. What is the quality of AquaGuard water or any RO water? Is it good for health?
It depends basically. The AquaGuard water or the RO water, basically the RO and all these guys, they come when the RO people, they always focus on TDS. And the recommended TDS should be around 50 to 300. But many of times these people, they show you that, the TDS in your tap water is this. Ideally, you should get an RO water because it is harming your body. So should not go a TDS of lower TDS because if you are lowering the TDS, you are removing all the good minerals from that water also.
So not too much, and I think moderation in everything is the answer.
Yes.
Dr. Ashok also supports you when you talked about the color and quantity of urine. Yes, Dr. Ashok, that is a good indicator of hydration status. Color as well as quantity of urine. Aditya has a question, Dr. Aditya. He says, when we use electrolyte drinks like Enerzel Zero, they have zero sugar, 0 calories, and they have electrolytes, good electrolytes. So how much can a person drink, maybe during the summer months?
Any amount, because they are providing a good amount of electrolytes and basically they have zero sugars. So even if the patient is taking for the hydration, they are not going to harm him.
So we can use it safely. And apart from Enerzel Zero, there is another brand known as Enerzel Blitz, which is quite low calorie. It is not 0 calorie. It is 29 calories per 100 ml. As opposed to maybe Limca, which is 77 calories per 100 ml. So it is about 1/3 the calories, less than that, about roughly 1/3 the calories that you would see in Limca. Dr. Sanjeev Puri, one last question if you can take, Dr. Navneet. Dr. Sanjeev Puri queries as to copper vessel stored water. Any comment on this?
Yes, people they have started storing water in the night, keeping in the copper vessel and drinking in the morning, and it is said that this copper vessel stored water is good for health, for improving your digestion, and it provides you antioxidant potential. But still, I think there are many RCTs on that, so we can comment.
So, Dr. Navneet, thank you. So much of insight, so much of information. You've spoken not only about medicine, clinical medicine, but also about public health. And you've spoken not only about health, but also about sanitation, engineering, and you've actually opened my eyes. So many things now that I know. The next time my RO person comes to do a service, I have so many questions to ask him now about what he's doing, what he's not doing. I can get the exact setting done at home for my RO filter. And most of the filters that you will have will be RO and UV together, RO and ultraviolet together.
Yes.
So now that we are empowered, now that we are informed, we can have a more meaningful discussion with our vendors. And we can also have a more meaningful discussion with our patients. Many times patients come to us with all these questions that you addressed today. So Dr. Navneet, I'd like to thank you once again. Thank you for highlighting the role of water in health and the role of health as related to water. When we began, we said that you wear multiple turbans, multiple hats. Would you like to speak about what you are doing in the field of diabetes across India?
As of now, as you rightly pointed out, that my main aim is to improving the affordable access to the diabetes care. And as you rightly said, that the diabetes care should reach to the last person, Antyodaya, and it should be for everyone, as you said, Sarvodaya. So we are doing through the but in the physical means you cannot reach to each and everyone across the country. So I'm with the digital health and with the virtual clinics. We are with our diabetes care programs through the app based and the mobile smartphone based programs. We are trying to reach each and everyone wherein we can help them managing their diabetes and achieving the target so that they can prevent the complications.
So, with that, Navneet, I'd like to thank you very much for having spared your time for us. We
Thank you,
acknowledge, we
sir.
appreciate your experience, your expertise, and we always look up to your eminence. So, thank you. And with that,
Thank you, sir.
I'd like to hand over again to Team FDC for their final comments.
Thank you, Dr. Navneet sir, for taking us through this wonderful topic on water and health and highlighting the benefits of it. And thank you, viewers, for taking out time on this Friday evening and attending this session, sir. Thank you so much. Thank you,
Thank
Dr. Kara, sir. Thank you. Good night.
Thank you, Sanjay sir. Thank you, Rahul. Thank you, FDC team, and thank you, the KK Agarwal Met Talk Show team, for inviting me and giving this opportunity. Thank you.
Thank you, everybody.
Thank
for
you
being
all.
with us.
Thanks to all the audience for being with us. Thank you.
Thank you, sir.